Back of knee pain. 4 reasons you have back of knee pain. 1. Hamstring tendonitis. If you experience sudden stiffness or pain behind knee at the start of your run, but it eventually subsides a few minutes into your workout, then you may have tendonitis in your hamstring. This typically occurs with runners who log longer distances and participate in road races, like a half marathon or marathon, and eventually don't get enough hip flexio from fatigue and improper technique. As you run, your hamstring fatigues and can no longer decelerate the foot from going forward in the same repetitive motion, so you'll start to experience pain behind knee, says Dr. Jessica Greaux, a biomechanist and founder of Press Play Performance Lab and Innersport Chiropractic in Berkeley, California. The overuse occurs when the lower leg swings forward like a pendulum and thus puts a strain on the hamstrings over and over during a long run. 2. Gastro Semillas tendonitis. This is the calf muscle that crosses behind the knee and attaches above the knee joint. The gastroc tendons can become strained when the knee is extended while the toes point upward, therefore pulling on the tendons. This is seen more in cyclists than runners due to improper fit or fatigued muscles elsewhere in the body, says Greaux. If a bike seat is too high or too far back, your calf muscles will be put in a vulnerable position. They can become strained if the butt muscles are not doing their job, especially with heavy climbing or uphill riding or running. 3. Baker's cyst. As you bend and straighten your leg, you'll feel a swollen lump and pain behind your knee, feels like a water balloon. Since runners do one thing, run, legs move in a very repetitive motion. Too much running without variations in speed or distance can cause excessive rubbing of the cartilages in and around the knee, which can irritate the soft tissues and posterior surface of the calf. 4. Torn meniscus. A sudden fall or twisting of the knee, or just plain wear and tear, can result in a tear to the meniscus that sits between the upper and lower leg bones. This cartilage is shaped like a horseshoe. This cartilage keeps your knee steady, but it is easily worn down with age. A small tear will result in minor swelling that will get better over 2 to 3 weeks. A more moderate tear is the type to cause pain when you bend your knee. While it may go away after a few weeks, it can easily be re-injured with overuse. The most severe cases of a meniscus tear will make it challenging to walk. Your knee may feel wobbly, or it may lock up or abruptly give out during any kind of activity.